Okay. Hi, my name is Tara, and this is my friend Britt. She's going to be my model tonight for my head, ears, eyes, nose, throat, respiratory, and cardiac assessment. So first things first, Britt, what is your name?
Brittany.
Okay. Do you know today's date?
June 5th,
And do you know where you're at?
New Jersey.
So Brittany gave me all the correct answers. So she's alert and oriented times 4 or 3. She's appropriately dressed for the season. So now I'm assessing, inspecting her head and her face and her overall skin complexion or skin. So it looks like her skin is appropriate for her ethnicity. I don't see any lesions. Her skin is intact. There's no bruising or anything like that, so her skin appears to be within normal limits. Looking at her head is normal cephalic. Her hair is evenly distributed. It doesn't appear to be any areas of baldness or thinning. Then I'm assessing her face. I'm looking at her skin on her face. There's no areas of dryness or flaking. Appears her features are symmetrical. I'm going to palpate her scalp. Brittany, I'm going to touch you, okay? So I'm palpating for any masses, any indentations. I'm looking to see if there's any infestations or just overall trauma. And she is negative for that. Britt, did you feel any pain?
No.
Okay. Then can I have you remove your glasses? While I'm palpating, I'm gonna move to the face, and what I'm gonna do is feel her temporal area for her pulses. Okay, and it's positive. I'll say with an intensity of 2+. Then what I want to do is I want to feel her maxillary sinuses. You feel any tenderness?
No.
Okay. Any tenderness?
No.
Okay. And do you feel any tenderness?
No.
Okay, so that's all normal signs. There's no abnormalities there. Then what I want to do is I'm looking at her eyebrows and her eyelashes. The hair is not sparse, so that's a good sign. Looking at her eyelids, there's no swelling. There's no evidence of a sty or an occluded sweat gland. I'm looking at her sclera of her eyes, which are white and moist. Then I'm also going to pull down her eyes because I want to look at her conjunctiva, which, okay, I'm going to pull them down, look up. The conjunctiva is pink and it's moist. And there's no discharge. So that's normal. Actually, now what I want to do is check the optic nerve. That's cranial nerve number 2. I want to do a vision test. It's a vision acuity test. So Brittany, the chart should be 20 feet away, and I'm going to have her use her glasses, and I want her to cover one of her eyes. I'll go this way, I don't know, so the chart is here. And I want you to read the smallest line you can.
DEFPOTEC.
Okay, and then can you cover your other eye?
DEFPOTEC.
Okay, and without covering.
DEFPOTEC.
Okay, so Brittany has no deficits. She has 20/20 vision with corrective lenses. Now I would like to do a nearsighted test, which she does not have to cover her eyes, but the card should be 14 inches away. Can you read?
LTFPH.
Okay, thank you. So with that being said, Brittany does not have any deficits. Her nearsighted vision is overall, it's pretty good. Then what I want to do is check her cranial nerves 3, 4, and 6. So what I'm going to do is actually, I would like to take a look at Brittany's pupils. Okay, can I have you? Okay. So what I'm going to do is come in and see if her pupils constrict, which they did equally, bilaterally. Then I want you to look at this pen light, and I'm going to bring it in close to you. Okay, so that's good. Her eyes were able to follow. And then what I want to do is the 6 fields of cardinal gaze. Okay, So I want to have you look at the tip of this pen light, and I want you to follow this tip of the pen light with your eyes, okay? Don't move your head or your neck, okay? Okay, and that was good. There was no signs of nystagmus. There wasn't any shaking or any lag with that. Also, what I also forgot is actually checking with visual acuity is her peripheral field. So what I want to do is I want her to tell me when she can first see my two fingers, and I'm checking her peripheral field again.
No.
Okay, that's good. So that was actually her optic nerve. Checking the peripheral vision, and when I checked for nystagmus was her cranial nerves 3, 4, and 6. Okay. I feel like I'm forgetting something, but okay. Also what I wanted to check too with this pen light is the Hirschberg test. I want to see the light reflect in both her pupils. So I'm gonna, which yes, the light does reflect equally bilaterally in her pupils. Okay. Then what I want to do is check the internal structure of her eye. Okay, I have my ophthalmoscope. I cannot say that. I'm checking. Okay, I'm checking for red reflex. Okay, the optic nerve is sharp. Okay. Okay, so Brittany, I didn't see any abnormalities. The optic disc was sharp, positive for red reflex, as well as there was no abnormalities like cotton wool spots or any hemorrhages in her retinal background. Okay, so now I want to move along to her ears. Okay, so looking at her ears, just inspecting that. The skin on her ears, there's no lesions, there's no redness or anything like that. The size of her ears, everything is symmetrical. There's no enlargement. I'm gonna then palpate her ears to see if there's any tenderness or any growths. Okay. You feel anything?
No.
Okay. I'm gonna palpate her tragus as well. Anything?
No.
Okay. So now what I want to do is take a look inside her ear, so view her tympanic membrane to see if there's any redness, if there's any bulging, just any signs of infection. So I'm going to her right ear, and what I want to do is actually turn on my light. That's what I'm going to do. I'm going to pull her ear up and back to view her tympanic membrane and her auditory canal. Okay, I see her tympanic membrane. It's pearly gray. The cone of light is at 5 o'clock, but there's no signs of infection. There's no drainage or redness or anything like that. I'm going to her left ear, and remember to pull it up and back. Okay, everything looks to be normal. Tympanic membrane is visible. It's pearly gray. There's no redness. No signs of infection, no excess of rumen. So that's good. Then I would like to get into the hearing test. First, I'm going to start with the Weber test. Okay. And this is checking for bone conduction. Oh, I'm sorry. Tell me if you can hear it in one ear or both ears.
Both.
Okay, so that's normal. So then now I want to do the RIN test, and this is a comparison of air conduction versus bone conduction. And I'm going to place this on the mastoid process. Tell me when you can't hear it anymore.
No. No.
Okay. Okay, so that's a normal rim test. So what we're checking for is any conductive hearing loss or sensorineural hearing loss. Okay, so now what I want to do is, can you occlude one ear? We're going to do the whisper test.
Apple, banana.
Okay, so our hearing is okay. All right, going to do it on the other side.
Cat, dog.
Okay, so there's no abnormalities there. Okay, so moving on to the nose. I guess I can use this one. I'm gonna actually inspect Brittany's nose. It's midline. There's no swelling, there's no redness or anything like that. Just from looking at it, it doesn't appear to be any type of discharge or any signs and symptoms of infection. What I want to do is palpate your nose. Okay. Do you have any tenderness?
No.
Okay, so there's no abnormalities there. Doesn't feel like a broken bone or anything is off. Okay. I'm gonna also check the patency of her nostrils. Okay, can I have you occlude one nostril? Breathe in and out for me through your nose. Okay. Can you do the other nostril? Okay. So there's no obstructions there. She has normal breathing through her nose. I'm going to take a look inside next. Okay. All right. Put it up there. All right. All right, so I don't see any abnormalities there. The mucosal membrane is a nice pink color. There's no drainage or anything like that. Septum is midline. There's no deviation. Also, I want to do a smell test. Okay. What do you smell?
Peppermint.
Okay, so her olfactory nerve is intact. All right, next thing I want to do is I want to take a look at her mouth. Okay, Brittany, I'm looking at the lips. They're midline, they're symmetrical. There's no swelling. The lips are not chapped. The skin looks to be normal. What I'm going to have you do is open your mouth for me. I'm going to take a look inside. Okay, so looking at the hard palate and the soft palate, everything looks to be intact. I don't see any evidence of any type of lesions. The mucosal membrane is pink. The hard palate is it's more like a lighter color. It's like more like an off pink color. I don't know if I'm describing that right, but there's no leukoplakia. Teeth look to be intact. There's no sign of dental caries, so that's a good thing. What I want Brittany to do is still checking the cranial nerves. What I want her to do is lift your eyebrows, close your eyes. Okay. Can you smile for me? Can you frown? So her facial nerve is intact. When it comes to her 12th cranial nerve, which is her tongue, can you stick out your tongue for me? Okay. Now, can you push against your cheek? Okay. Okay, so cranial nerve 12 is intact. Can you swallow for me? All right, that's cranial nerve. That's your that's your glossopharyngeal nerve. I am so sorry, I'm getting that confused. That is actually intact as well. There's no deficits there. And did I ask, did you have any issues swallowing?
No.
Okay. All right, so now what I want to do is have her stick out her tongue and say, ah. You know what? A pen light would help with that. Okay, so her uvula is midline, as well as I wanted to mention that her tonsils were about a 1, but they're still, they're not swelling or anything or occluding her throat. So that's a good sign. And then now I want to check her gag reflex. And that's the vagus nerve. Okay, sorry. All right, so that seems to be working. There's no deficits in that area as well. Now I would like to check your neck. So I'm looking at her neck. Her neck is midline. It doesn't appear to be any type of abnormalities there. Can you move your neck side to side? Okay. How does that feel?
Fine.
Okay. Can you shrug your shoulders? Okay. Everything seems to be okay. What I'm gonna do is now I'm gonna feel your trachea. Okay. The trachea is midline. And I'm also looking at her skin. Her skin is intact. There's no lesions or abnormalities there. Then what I want to do is feel her thyroid posteriorly. Okay. Now can you swallow for me? Okay. So there's no abnormalities there. There's no goiter. I don't feel any nodules, so that's a good sign. What I want to do is I want to check lymph nodes. Okay. So this is pre-auricular, post-auricular. Sorry. This is tonsillar, submandibular, submental. Okay, and this is my anterior cervical chain. Then I want to do my occipital. Then I want to do my posterior cervical chain. And this is supraclavicular. I palpated. I didn't feel any masses. I didn't feel any swelling. Nothing was fixed in place or hardened. So there's no signs of infection. Okay. So now getting into the respiratory and assessing Brittany's lungs. So what I'm going to do is I'm actually looking at at her throat. I know I said her trachea was midline, so that's good. That's not abnormal. Just looking at her chest. I'm sorry, I'm going to open up. Excuse me. So I'm looking at her chest rise and chest fall. And it looks to be symmetrical with her back, so that's good. I don't see any use of any accessory muscles. She doesn't look like she's in any respiratory distress or there's any nasal flaring. Her diaphragmatic excursion, it looks to be 3 to 5 centimeters, and that's very normal. So what I'm gonna do is check for tactile fremitus, okay? So I'm going to place my hand on her shoulders and I need you to say 99.
99. 99.
Sorry.
99.
Okay, and then I'm going to have you move to the back. Okay.
99. 99. 99. 99.
Okay, so there's no vibrations or anything abnormal. Then what I'm going to do is percuss, okay? I'm going to have you, yep. Going to come around. Okay, and what's normal and what I heard was a low dullness, which is normal for the lungs. Next one I'm going to do is take a listen. I'm going to actually listen to her trachea first. So that's going to be broncho-vesicular, and vesicular breath sounds. Sorry. Now I'm going to go to the back. for me? Okay, so there were no signs of any abnormal lung sounds. All lung sounds were present in all lung fields. No adventitious breath sounds, no crackles, no wheezings, no rhonchi, no stridor, no anything. So that's pretty good. So now what I want to do is now get into cardiac. We're going to be assessing Brittany's chest. And what I want to mention is, especially in someone, what I forgot to mention earlier is, especially with respiratory and patients with color, we want to assess their lips to see if it's cyanotic. Now, as a vascular, I'm also again going to inspect Brittany's chest. Feeling for the precordium is feeling her chest to see if there's any vibration, because with the PMI should be at the 5th intercostal space. There was no abnormalities there. If it was something that was abnormal, then most likely it would be due to left ventricular hypertrophy, and that's something that you would see in chronic heart failure. So there was no abnormalities there. I want to check Brittany's carotid arteries. You do it one at a time. Okay, that's normal. I will rate that intensity of 2. Okay, then I would like to feel her brachial pulses. Okay. All right. They're equal bilaterally. Then her radial pulses, equal bilaterally, and I would say that's a +2. Then her ulnar, okay, that's equal bilaterally. And then I'm going to do her popliteal. Okay, that's equal bilateral. All right, then I'm gonna do behind her dorsalis penis, equal bilateral, and then her pedal pulses. Let me put your feet on the floor. Oh, I hope you can see it. Okay, that's equal bilateral as well. Then if I'm checking capillary refill, I would press on her fingernails, each one, to make sure each one is 3 seconds or less. Okay, that's good. And then assessing Brittany's lower extremities, it's no swelling. So it looks like with this assessment, it's normal finding. And also I would like to check her jugular vein. So I'm gonna have her lay down. You're good. Lift your head up. Okay, and turn the other way. All right, and there's no jugular vein distension. Let me help you up. And that is it.
Oh, my heart.
Oh my God, and I'm sorry, I forgot. I have to listen to her heart. Okay. I'm gonna start again. So this is my aortic, and this is at the 2nd intercostal space. I'm gonna find her sternal notch, go down to the ankle of Lou, and then this is your right sternal border. And then pulmonic is the left sternal border, 2nd intercostal space. Erb's point is the, 3rd intercostal space. All right. Then tricuspid is the 4th intercostal space. And then my mitral, this is the apex of the heart. Sorry. And this is the mid-clavicular line. That's the 5th intercostal space. Okay, and I don't hear any abnormalities. No murmurs or anything like that. Thank you. That's